Welcome to your online epilepsy training presentation delivered to you by Compass.
Epilepsy is more common than people think. 63,000 children and young people aged 18 and under have epilepsy in the UK, and that's enough to fill the Arsenal Emirates Stadium. 87% of people are diagnosed with epilepsy every day in the UK, and 5% will be affected by flashing lights. Even famous people have epilepsy, such as Lil Wayne. He's a rapper and superstar. He's had seizures since childhood. Reynold Mackenzie Lyle, he's a footballer diagnosed with epilepsy at 18 years old. Theodore Roosevelt, who's the 26th President of the United States of America, and Susan Boyle, who's a singer, was diagnosed with epilepsy since she was a young child.
Martin Kemp, who was diagnosed with epilepsy following a brain tumour, and Prince, who was born with epilepsy and had seizures until he was 7.
People with epilepsy experience a sudden burst of electricity in the brain. This is called a seizure. Seizures disrupt the way the brain works for a short time. This disruption in the brain can cause the person's behaviour or the way they feel to change. A seizure can take effect quickly without any warning.
The brain is complex, therefore so is epilepsy, and no two people have the same seizure.
Some of the causes of epilepsy can be because part of the brain's injured. This may happen during pregnancy, a difficult birth, or from a head injury. Illnesses and infections can also cause epilepsy. Some types of epilepsies can be passed down through families and caused because of genetics. However, 60% of the time, the cause of someone's epilepsy is actually unknown.
A seizure threshold is a person's individual level of resistance to seizures. Any of us could have a seizure under some circumstances, such as trauma, but for most people, their natural resistance to having seizures is high enough to stop that happening. Causes of low thresholds could include stress, sleep deprivation, alcohol, menstruation, especially in children, recurrent infection and fever. Certain medication can also lower the seizure threshold, such as anti-cancer drugs and opioids like tramadol. However, all opioids have the ability to lower the seizure threshold. Non-opioids such as aspirin, diclofenac, paracetamol and ibuprofen do not appear to lower the seizure threshold.
Everyone's individual, and it's important to remember that different things can trigger a seizure. Some of the known physical triggers include missed regular medication, a use of recreational drugs and excessive alcohol, and if a child or young person is unwell or has a high temperature or is experiencing health issues such as constipation, this can also increase the risk of a seizure. It's important to consider that going through puberty can also impact on a young person's epilepsy. There can also be psychological explanations for increased seizures, such as lack of sleep, stress and anxiety. It's important to be aware of the school environment, as this can also impact on people's epilepsy. This is sometimes known as photosensitive epilepsy, which is when seizures are triggered by flickering or flashing lights or patterns of high contrast and moving lights. With this in mind, we should consider things such as lighting, screen use and playing videos in the classroom. 3 in every 100 people have photosensitive epilepsy. Sometimes children and young people will have a feeling or sensation that could be an early warning sign that they're about to have a seizure. Common things children and young people have shared include feeling a cold breeze, seeing a bright light, pain or discomfort, experiencing an unusual taste or smell, a feeling of deja vu, or a strange sensation in their body. When someone has focal seizure, the electrical messages only cause disruption in one part of the brain. Anything this area of the brain controls could be temporarily disrupted, which could affect the person's sight, smell, hearing, taste, touch, movement and emotions. This slide represents what might happen when different areas of the brain are affected by the electrical discharge. The occipital lobe, shown in green, controls sight. Therefore, the person could experience temporary blindness, hallucinations or distorted vision. The parietal lobe, shown in yellow, is responsible for sensory information and orientation, which can affect light, touch, temperature, pressure and pain, and they may experience feelings like pins and needles or a warmth or numbness. The temporal lobe, shown in blue, controls speech. Speech may become slurred or they may not make sense when they're talking. The person may also not be able to speak. The frontal lobe, shown in pink, controls movements, behaviour and attention. They may walk around in a confused manner, appear drunk, pluck at their clothes or make strange facial expressions. Absent seizures are one of the many types of seizures where the burst of electrical activity disrupts all of the brain at once. During absent seizures, the person will suddenly freeze and stop what they're doing for a few seconds, but they may remain standing or sitting as they were before. These seizures can happen many times a day, so they can miss lots of bits of information unless you realise what's happening and help them catch up. When a pupil has an absent seizure, they may need your help to stay safe because they could suddenly stop what they're doing. This could impact on things in the school day such as science experiments and working with equipment in design and technology. Therefore, it's important to be considerate of children and young people with epilepsy when planning lessons. If a child has an absent or focal seizure in a busy corridor, you may need to guide them away from any dangers. After a child has a focal or absent seizure, it's important to stay with them until their recovery is complete. Be calm and reassuring and explain to them anything that they might have missed. It would also be beneficial to time how long the seizure lasts and make a record of this to inform parents, as this may help to build a picture of how the child's epilepsy is impacting on their life.
You need to know what's usual for the individual and what may be different, and make a note of that to pass on to parents.
In focal and absent seizures, the discharges of electrical activity can spread to the entire brain, resulting in generalised seizures known as tonic and clonic. A tonic-clonic seizure is a generalised seizure where the burst of electrical activity disrupts all of the brain at once. Tonic means stiffening and clonic means shaking or convulsions. Firstly, the person becomes unconscious, then the electrical messages are sent out of the brain to all of the muscles in the body at once, making the person go stiff and fall to the floor. This will be followed by clonic movements, which will present as jerking. In this phase of the seizure, the person may lose control of their bladder or bowels. Therefore, to protect their dignity, you may want to cover them with a blanket or a jacket. The person will not feel any pain during the seizure because of the disruption in the brain, but if they injure themselves during it, they may experience pain afterwards, so it's important to be mindful of this. Most tonic-clonic seizures last no more than 2 to 3 minutes. When caring for a child having a tonic-clonic seizure, it's important to time when the seizure starts and ends. Make the area safe, prevent people from crowding around and observing, and remove objects away that the person could injure themselves on if possible. An ambulance will need calling if seizure continues for more than 5 minutes, or if it's stated to call the ambulance sooner on the individual healthcare plan provided by the specialist epilepsy nurse. Put something soft under their head to protect them from injury, and don't put anything in their mouth unless it's prescribed emergency buccal medication. To administer emergency medication for epilepsy, you will require further training than the one delivered today. Stay calm and reassure the person and speak to them until they've come round. It's important to remember that children and young people may feel tired afterwards and their muscles may hurt, therefore they might need to rest. Following the seizure, put the child or young person in the recovery position, but only once the shaking's stopped. Moving a person during a seizure can be difficult and can cause injury to both the person and the helper. Therefore, only move the person if they're in immediate danger, such as having a seizure in the middle of the road. When putting a child or young person in the recovery position, you place the back of the hand to the cheek, lift up the knee and roll them onto their side. However, if you're struggling to remember this at the time, it's just important to make sure that the child's turned onto the side to prevent them from swallowing any secretions or vomit.
However, if you can stay with the individual and they're not compromised, then you don't need to put them in the recovery position. If you need to leave the individual or they're at risk of vomiting, then put them in the recovery position.
This is a picture of the Epilepsy Action poster, which talks through how to care for a child during and after a tonic-clonic seizure. You can download this from the Epilepsy Action website and display it around school as a reminder to staff and young people.
A young person who has epilepsy may feel isolated because they are different, which may lead to feelings of low self-esteem and low self-worth. Young people have difficulty adjusting to their seizures and may exhibit hyperactivity, anxiety or aggression, which may further distance them from their peers.
Sometimes people can be worried about keeping those with epilepsy safe, so they don't let them do some of the activities that most young people their age are allowed to. Children and young people who have epilepsy shouldn't be excluded from normal school activities. However, assessments will need to be made to ensure these are kept safe. For example, swimming, which can be made safe by taking some additional steps such as informing the lifeguard of the child's epilepsy. Some pupils may also need advice on safety issues relating to their epilepsy. These could include carrying an SOS card, drinking alcohol, swimming alone and driving. Therefore, it's important to be aware of who you can signpost children and young people to for this advice, such as Epilepsy Action. Deep Action is a charity that raises awareness of the risks of epilepsy and the possibility of death. Deep stands for the sudden and unexplained death in epilepsy, which is when a person with epilepsy dies suddenly and prematurely and the reason for death cannot be found. Approximately 3 people per day die of Deep. This often occurs at night when seizures are unwitnessed, and there's ongoing research looking for causes of Deep, so we just wanted to make you aware of the charity and the work that they do.
Deep affects more young adult males than females. Deep can be higher if people have symptomatic epilepsy. Deep can be higher if people don't respond well to treatment. Public Health England also suggests that people with epilepsy are 3 times more likely to die from the condition if they live in a deprived area.
Risk factors that increase the likelihood of Deep occurring include having active seizures, having seizures at night, not taking prescribed medication regularly, or taking recreational drugs or drinking excessive alcohol. Having epilepsy since childhood can also increase the risk of Deep. Therefore, it's important to regularly speak to health professionals and manage epilepsy. Frequent seizures don't need to occur for a child or young person to be at risk of Deep. Some top tips for schools include: pupils only require a healthcare plan if their epilepsy impacts upon their school day. Where a healthcare plan is required, it should be reviewed annually. Healthcare plans are important as they provide advice to follow should a child or young person have a seizure in school. Staff should make a record of the seizure by documenting what happened before, during and after the seizure and what actions they took. This should be kept in the pupil's school record and shared with parents and relevant health services.
We suggest schools carry out a medical drill to ensure they're clear of the plan if an emergency event occurs. This will give you the opportunity to address any issues within a mock-up situation rather than a live one. It may also be worth downloading the What 3 Words app on your phones, as this is designed to allow the ambulance service to identify any location within around 3 metres. This may be particularly useful if you're attending any rural school trips.
Some key points to remember include call an ambulance when this is required, or if they've sustained an injury during the seizure. During a seizure, we need to keep the person safe and stay with them until they've recovered. Ensure the pupil has a recap on anything that they might have missed. Be aware of how the seizure manifests itself according to what part of the brain is affected, and ensure correct documentation. Schools should have indemnity insurance to cover them regarding the actions that they take caring for a child or young person with any health conditions. Epilepsy can manifest itself in many different ways, and it can be quite simple, but it can also be quite complex. So if you've got any more questions, don't hesitate to contact us. Thanks for watching. You'll now see a video showing how the different types of seizures can present and how these can be appropriately managed.